So this is my last video diary, and it's been a really fantastic experience to be able to share the last 12 months of my quality improvement journey with you, and it's been a lovely time for me to manage to put into practice my learning from the General Practice Improvement Leaders Programme. In previous video diaries I talked about our appointments for hay fever that were taking up about 10% of our total GP appointment time in the summer, and now summer's come round again a year later and we have 0% patients asking us for hay fever medications and consulting with us. And this has shown me that it's really important to stick with the change. Change can be hard, but if you give it enough time, you can see sustainable changes, and we're really pleased that now that hay fever season has come again, that we've made a 10% saving on our very precious GP appointments. Another update has been our online booking appointments. We found that patients have been increasingly booking online appointments, and we've had a 50% increase in the number of appointments the patients are booking directly online, and so they're freeing up reception time who are not needing to answer the phone or seeing patients at the desk to book these appointments, so they're available to help with chronic disease management recalls. My learning from these two wonderful examples for me is that change takes time, and it's important not to give up, because sustainable change does take time, but the rewards at the end of it are definitely worth it. Quality improvement has helped our team come together really well. It's now embedded in our culture, and staff are not afraid to give their ideas because of the leadership by all aspect that I learnt about in the change model. We can all have a say, from receptionist to lead GP, and if we spot any challenges or issues, then we turn to quality improvement to solve the problem, and that's something we never had before. So for patients, they now have more access to the doctors and the nurses, and we're able to provide appropriate appointments to give patients the right care at the right time. So quality improvement's definitely going to continue at the project surgery, and our next project is about how to manage our hypertensive patients more efficiently. We're thinking about increasing access for patients so they don't need booked appointments, and decreasing the doctor appointment time from 10 minutes to just a couple of minutes to review things. So personally for me, I'm going to be the quality improvement lead in our cluster of 7 practices, which will involve me going into practices and facilitating and helping them with their own projects. Also with the medical school, I'm going to go in to teach some quality improvement right down to our first and second year medical students, so that they can be introduced to this early. I was always sad that I had to wait after 15 years of being a GP to be introduced to this, and I'm really keen for these skills to be passed on to our younger colleagues. From my experience, my advice to any practices who haven't embarked on their journey yet is to just give it a go. It can be lots of fun, it can really improve your practice, and it can really bring your team together. You might find some real hidden jewels in your practice staff that you didn't know existed. It will improve your working day in the practice, because things will run more smoothly and efficiently, and patients will get the right care at the right time that they need. My advice is to give quality improvement a go. I wish you all the best on your quality improvement journey, and I hope that you have as much fun and success as we've had.